So the American Osteopathic Association has an official definition of what osteopathic medicine is. But if you ask 10 DOs what osteopathic medicine is, you'll get 10 different versions of it. And that's part of the strength and the beauty of the profession, because people can personalize what it means to them and how they approach patient care using the tenets and the foundations of osteopathic medicine. Most patients wouldn't be able to detect a difference between, seeing an MD and DO. And it's very common for patients to go through the health system not knowing that their doctor was a DO. MDs and DOs go through 4 years of medical school, and after that, you're not a physician. You're not a physician until you go into specialty training in residency, and then you can get your medical license to practice. So both MDs and DOs train in the same institutions. We take the same board specialty exams, and we train alongside each other. So there's the clinical skills of, besides medicine and surgery and all the other venues we have for making people get well, DOs are trained to use their hands, both to help diagnose and treat, particularly neuromusculoskeletal problems. And the neuromusculoskeletal system is the foundation of the body. It's the structural foundation. And so in the mid-1800s, when an MD named Andrew Taylor Still lost some of his family members to an epidemic where he was helpless to do anything. The medications at that time were very crude, mostly alcohol-based, and had even toxins in them. And so they were useless in helping to treat his family and keep them from dying. And so he started thinking about what keeps a person healthy. And he came back to the kind of the core of, if the structure is not intact and solid, if you don't have a solid foundation, it's going to affect the functioning of the body and make the body vulnerable to illness and disease. And so his basis was, let's get the structure right, the skeleton, the muscles, the ligaments, the tendons, and they all impact on blood flow and nerve conduction. And so if you have a strong foundation, then these other things can operate effectively and optimally. And it's not a panacea, it doesn't fix everything, it's not going to cure cancer, but the highest percentage of complaints of patients, that is, patient complaints when they come into your office, is musculoskeletal. And so if you have this skill set, you can help patients to get better structurally without relying on muscle relaxants and pain medicine and those type of things. This is the Osteopathic Principles and Practice Laboratory. And this is where students first learn how to be able to examine and diagnose and treat patients that have particularly musculoskeletal complaints. But as well, they learn about how other types of illness can be addressed by osteopathic manipulative treatment. So for example, if someone has an acute exacerbation of asthma, well, certainly there is a standard treatment regimen that you embrace. And it's bronchodilators and maybe even epinephrine, and that's essential. But we know that in this particular expression of the disease, the rib cage, the chest wall, doesn't move as well as it needs to. And there's restriction of air going in and out. And so there's some techniques called rib raising, which facilitate the movement of the ribs on the chest wall that allow for greater movement of air. Someone who has a sinus infection, and if it's deemed to be bacterial, you give an antibiotic. But there's also some very easy techniques to help drain the sinuses and get those fluids moving so they're not congested and feel that pressure that you usually have. So we don't teach in isolation, memorize these techniques, this is where you find the lesions, this is how you treat them. Here's a patient that comes into your office with asthma and having difficult breathing. How can you help, besides medications, to help this person breathe easier and relieve some of their distress? DOs don't look at the disease that a person has. DOs look at a person who happens to have a disease. And there's a marked difference. If you ask enough questions of your patients, you're going to get the answers you need. Patients have to be part of this relationship. You can't just focus on someone's organ system that's diseased and say, well, I'm going to treat your kidney, okay? No, I'm going to treat you. And the way we're going to do this is treat you so that your kidney gets better. There are so many factors that are involved with wellness and disease. How you live your life, what do you eat, how active are you, how much exercise do you get, how much alcohol, tobacco do you use, do you use your seatbelts, do you drive excessively fast, are you thoughtful about all these different things, because they all have an impact and an influence on your health and your wellness and your liability or your likelihood, rather, of becoming unwell. Some of the things we talked about, a holistic approach to patient care, that's not something osteopathic medicine owns. That's what makes up a good physician, whether you're an MD or DO.